Namaste, everyone. This is Srinivas Samadhanali. I'll continue my solo conversation, solo talk about the health data. So we talked about the health progress in the earlier video. So we talked about immense progress made on life expectancy, also significant, significant drop in maternal mortality, infantile mortality, and control or eradication of many of the infectious diseases, the pandemics like smallpox, polio, and things like that, right? So, and even HIV, we are able to contain it significantly. TB has been kind of again contained to a large extent as well. Then leprosy has become lesser and lesser. So those are really, really good progresses. So I think we'll have to keep those in mind. And life expectancy has increased from mid 30s to mid 70s now globally over the last 50 to 70 years. Okay, so now let's look at some of the challenges. So definitely we have made significant progress, but there are definitely significant challenges. In fact, many of them are kind of evolving. These pictures I created for the interactive session. So the first picture shows the potential. This is a coronavirus, COVID-19 virus image. So and then this is the demographic, what they call disaster. Essentially, many developed countries, some of the developing countries are middle income countries like China. So where the population is aging, and they'll have fewer and fewer younger population, working age population, and there'll be more older age population to take care, right? And then whereas the similar reverse is also true in many of the developing countries, especially in sub-Saharan Africa, like Nigeria and other countries. And in India, I mean, in South Asia, we have Pakistan and to some extent India as well, where the current population is continuing to grow significantly, especially Pakistan is growing significantly. In India, it's kind of slowed down, but still because of the high base, still the population is growing. So this is about the potential climate change impact, high rain or heavy rain or no rain, severe drought, etc. So and also there can be because of severe weather conditions, so there can be floods, snowstorms, whatnot, right? So that can upset a lot of things in terms of food production, safety, etc. Right, and the cost of healthcare is also significantly challenged. So these are the things we'll be talking quickly with the data. Okay. As I said, significant progress have been made. But still there are risks of pandemic. We have been hearing about a lot of them. In fact, not hearing. We have seen these pandemics kind of time to time explode in some pockets of the world. The COVID-19 has killed more than 15 million people over the period of 2 to 3 years. And in fact, 15 million is very conservative number. Officially, 7 million people have died, but it's well known that anywhere from 15 million to 30 million people have died. Okay, so as I said earlier, global aging population is an issue, and then there is also poor, of African and they are facing still continuing to face population explosion. Another major thing that is happening is these diseases are infectious diseases have come down globally. Now the challenges are with the non-communicable diseases like cardiovascular, cancer, diabetes, etc. So just to give the kind of what pandemics can really cause, in the kind of significant impact it can have on the world, COVID-19, in just matter of 2 years, it kind of erased the progress that was made in the previous 10 years. So the life expectancy in 2013, global life expectancy was 73.1 years. In just 2 years, it dropped to 71.4 years. This is kind of reversal of what was achieved in the earlier 10 years. Okay. This can happen anytime. We need to be prepared, at least aware of it, aware of such risk. and it also hopefully the policymakers, the healthcare professionals and the organizations, and also as individuals, we need to be kind of supporting to be ready for these kind of things. Globally, as I said earlier, so um, between just 2021 and so the estimated excess death is about $15 million, whereas the official claim deaths are about 7 million, by the various governments. So this underreporting of the deaths is definitely there across the world. It's not just India, even India it has been there. And China number is totally unknown. So, the second, it was the most populous country when this pandemic hit. So, and it was the first one, first major country to be hit for a long time. And definitely they would have higher deaths, but we don't know what the numbers are. Okay. And so, according to some estimation, so the for the 3 year period, it's the actual death could be as high as 19 million to 36 million excess deaths. So, coming back to this again, the risks of these pandemics are always there. We need to be prepared. Nothing can be taken for granted, despite huge achievements in this health space. Okay. And the next major challenge, as I said, the two kinds of population challenge. One is the demographic, what they call disasters. Essentially, the birth rates are decreasing, or total fertility rate (TFRs) are decreasing in most of the developed countries and some developing countries like China. You can see as of now, the population in the middle is high as of 2020, and you see the smaller age population in another 75 years in years, so they would have very little younger population, and they will see the middle to higher age there will be more and more people. So with this, so we can see that the fertility rates in China is about, as of now 2020, it's 1.16. Japan is 1.3. In fact, China is middle income country, and Japan is a developed country. It's China's population is even lower than the developed country like Japan. India, it was at 6 in 1960. It has dropped to roughly about 2.1 in 2020. And I think it's barely at a replacement number. I think it's a good thing. I will talk about that a little later. So China, it was seven plus in 1960s, and it dropped to 1.16, 10, yeah, 16. So this decrease in the fertility rate is happening across the world except Africa and Pakistan. Okay, so but they will have their own challenges. Okay, so I'll talk about that in the next slide. So as you can see, I've taken this for Japan. This is one of the most aged country in the world. Essentially, there are significant part of the population is aged. As you can see, in the 1950s, there was a very small percentage of 60 plus, 65 plus population, and it increased significantly by 2023. You can see, and its younger age population is shrinking. So what will happen with this having a younger age population? Two kinds of problems can happen. One, the younger age population means that there will be a lot of challenges in terms of meeting the societal needs for the workforce. You need people for so doing various things: health, education, infrastructure, building, and so on and so forth. Right. So there will be limited workforce available. There will be too much of a demand. That's one side, workforce challenge. And the second thing is the taxes that government needs. There will be fewer people will be paying taxes because the working age population is small, and they need more taxes to support the age population. Right, age population requires retirement benefits, healthcare benefits, whatnot. Right. So for that, we'll have financial challenges and then also workforce challenges. So that would be the challenge with the demographic disasters that are happening. These are not, definitely these are addressable. Some of the concept of Retirement has to be redefined, right? So that so people just don't drop off working at the end of say 65 years or 70 years. So they kind of ramp down and they work as long as they can. So in fact, one of the major cause for the poor health after retirement, suddenly they stop working, right? So they become idle, their mind and body becomes idle, and that is the biggest contributor for poor health apart from the age related body issues. So what has to happen is the attitude has to change, mindsets have to change, and the public policies have to change as well with the kind of what is it that some some good dialogues happening across the cultures and then the age groups, so that this transition from the current way of retirement has to be redefined. Okay, so with age population also contributing to the workforce to some extent, it will also help address some of the workforce challenge that would be there. And with the active involvement in the work, even though the lower responsibility, that will also help in terms of improving the health of the retirees. So this, this restoring the fertility rate to keep the current population or continue to growing, that is not sustainable from financial or or the ecological perspective. Okay, so USA is India is no different in terms of fertility rate dropping, but the thing is that so we already have significantly high population and high density. Really, really, we have very high density. We have about 400 plus people for every single kilometer, sorry, square kilometer, and some of the belts like from my Gangetic belt from Delhi to Kolkata to Dhaka, that entire belt, for every single kilometer, there are more than 1,000 people for every single kilometer, right? So that should support food production, housing, in other infrastructure, roads infrastructure, schools, hospitals, industries, water treatment, whatnot, right? So how can you really accommodate 1,000 plus people in every single square kilometer for nearly about 50 crore population from Delhi to Dhaka? That's really, said that including India and Bangladesh together. So that kind of population density is extremely hard to sustain, and it's going to be a ecological disaster. Okay? So just to give some kind of the kind of the shape and size of this problem, in just last 25 years we have added 45 crore people. Think about this. 45 crore population is the population of USA, Canada, and Australia put together. These countries have grown to this kind of that kind of population over 200, 300 years. They built the huge infrastructure of housing, transportation, educational healthcare infrastructure, right? Over 200 years. Now we have this 45 crore people to be, kind of cared for and to be leveraged, right? With good health and education and whatnot, right? How can we provide that this kind of population on top of the 100 crore population we already had by that time, right? So it's a huge challenge. I think people have to realize that having higher population is not the right thing for many countries like India. In fact, the higher population was a great advantage. Bihar and UP would be the most advanced states in India, and similarly, Pakistan would have beaten India and Bangladesh in terms of various aspects, right? And even for that matter, it would have beaten China if the population was high population growth and densities are the key concern. Then it would have been beaten China for that matter, for that kind of population. It hasn't. In fact, why they have whether it's Pakistan or UP or Bihar or Tripura or Jharkhand, why they are struggling? Because there are too many people, incremental population that they have to care for. Instead of improving the existing schools, existing hospitals, or existing cities and villages, you have to build new ones. Most of your money and the resources are going to just to barely support, provide bare minimum support to this new population, right? So this population growth is totally unnecessary in many parts of the world, especially in South Asia, right? It's a huge burden. no matter what the economists tell, what the journalists tell. They, I don't think they're really understanding. They don't, and the ecologists and many of the climatologists, they talk about all the impacts of the emissions and other things, but two key contributor to the emissions and the pollutions and the stress on the various natural resources are coming from the exploded population and exploded consumption by this population, right? So this high population densities are not really beneficial or sustainable for anybody in the medium to longer run. So just to give a little bit of context to this, for fertility rate, as I said, this is as of 2019-20. We have still has a population, fertility rate of 3.2. It's already, 1,200 or so in terms of the population density for every single square kilometer. So good thing is the birth rates are the TFRs, total fertility rate. It has come down everywhere. And you can see in 1960, China had a 7.5 birth rate. And as of 2023, it has dropped to nearly 1. So that's amazing. And it's a really positive thing. I don't think we really need to worry if you're looking from medium to long term, both financially, economically, socially, and ecologically, more than anything ecologically. Okay. So India is, dropped from 6th birth rate in 1963, and by 1997 it was at 3.5, and by end of 2023 it was 2. Okay. So Bangladesh has dropped as well, and so the Pakistan I should have put. I don't have it, and some of the countries like South Korea have really low fertility rate. But I think it should be fine. So I think one thing we need to really remember that the artificial intelligence is providing a lot of what is it, the expertise that would be required, and then the robotics and the various automations that are already in place and are coming up, will replace a lot of the brawn power and the muscle power, the physical work need to be fulfilled by the human workforce will come down as well, right? I think, in my opinion, with your lower population, just to give kind of a little bit of context, just 100 years ago, the whole world's population was 2 billion. Okay, now it is about 8 billion, 4 times for every one person that was there 100 years ago. Now we have 4 people. Okay, really, world cannot sustain, the earth cannot sustain this kind of human population and this kind of human consumption that has been happening. And with the economic growth, the consumption will continue to grow no matter what, right? So, if you with more people having affordability, will drink more coffee, tea. That means cutting down a lot of forests, and more palm oil consumption. That means again cutting down a lot of virgin, the green, what is it, rainforest. And then people will be eating more beef. That means there will be more South American and African countries will be producing beef by cutting down the forest, right? And then you need more food grains, means we'll be cutting a lot of, increasing the land utilization for producing various food grains, and need for the housing, industries, infrastructure, right, roads, power lines, whatnot. It will put immense pressure, right? So both human population and human consumptions have to come down if the world has to survive. It is not just the emissions alone. I think that's the myth that okay, if we replace all the automobiles with the fossil fuel consuming automobiles with the electric vehicle, problem will be solved. No, that is not that is one of the issues, but there are so many other materials we are over consuming. So the next major issues, as I said, is the the explosion of non-communicable diseases. That means they don't spread from person to person through infections like virus and bacteria, but they are related to lifestyles. Lifestyles, having how we live and work and what we eat and how we sleep and etc. Right. So these non-communicable diseases are result of various technological and economical changes that have happened. Right, more and more people are working, sitting in the office, are doing lesser and lesser, physical work. So with that, obesity has increased, and then with the kind of too much of over nutrition and wrong nutrition, we're eating too much of oil, salt, sugar, etc., and more processed foods and more food, right? So with all these things, so the obesity is increasing, cardiovascular disease, that heart and brain related issues, and then the vascular related issues, right? Varicose veins and things like they are increasing. Incidences of cancer is increasing, Alzheimer is increasing, Parkinson is increasing, etc. Right? So, and then diabetes. I've not listed. The diabetes and then the hypertensions are increasing as well. So one of the key reasons for this one is obviously the lifestyle and food habits, and then the third thing is the increased life expectancy. People used to live much shorter life earlier. Now they're living, majority of them are living beyond 60 and 70 years. The risk of these things happening is very high, right? So with this, one, healthcare costs will go up. It will be a big burden on government, society, and the healthcare organizations, right? So we have to be prepared. We have to cut down, or sorry, minimize the chance of this lifestyle, NCDs, so that it becomes financially viable, economically viable, and socially viable as well. Socially, in the sense, how long families can support people with these kind of issues, right? So it becomes really big burden on the families and individuals as well. And the quality of life for individuals will also suffer. Just to give a little bit of context to this NCDs, globally, you can see that cardiovascular diseases are the major cardiovascular cancers, chronic respiratory diseases, digestive disorder, lower respiratory infections, dementia. Right? These are all NCDs, non-communicable diseases that have they become the main number one death causes globally. And if you look at the same thing for India, you can see the same thing. Cardiovascular disease, chronic respiratory disease, cancer, digestive diseases, lower respiratory, tuberculosis. I mean, majority of these are, lifestyle related issues. Tuberculosis is not necessarily lifestyle, but infectious disease. Remaining ones are, primarily, NCDs. And in terms of the percentage of the this one, as of 2019, about 77 million individuals had diabetes in India. This seemed to be very conservative number. Number could be really higher than this. And based on my own experience, how people have been kind of impacted both in urban as well as the rural areas. Okay, and it will lead to a lot of other infections, multi-organ, not infection, multi-organ impacts. So there is impact on the heart, lungs, and then brain, kidneys, and whatnot. Right? Just to give some more context or data to this NCDs, so in 1990, 53% of the deaths were happening because of infectious disease, whereas 38% was because of NCDs, and only 8.5% were because of injuries. Whereas by 2016, infectious diseases came down from 53 to 27%, whereas the NCDs went up from 38% to 62%. Okay. So the injuries increased from 8.5 to 10.5. So the significant jump is on the NCD. Right? Next major challenge is the cost front. I think this is a challenge across the world and especially severe in the developing world. So because of the age population and then the escalate cost escalation that have happened. So just to this is an issue everywhere, but it's very pronounced in the developed world. This is some data here. Like as you can see, the data from 1880 and what's there, but I have taken from 1960. The average, the healthcare spending as percentage of GDP was about anywhere from 1 to 2% in the developed world. Okay, now it is about 10 to 11%. Okay, so the US is really an outlier. I'm not shown it here in the kind of list of developed world. And they have where their healthcare spending is there. It has reached nearly 18% of the GDP. as of 2023. Whereas rest of the developed world is about anywhere from 10 to 11%. One side you can say that yeah, it's good that they're spending that kind of money for healthcare, which is good thing. It creates employment, it improves the health, and it improves the the life expectancy, and also it will have positive impact on the society as well, right? Because the people will live longer and they'll be producing, creating and producing, serving the communities for longer period, right? The quality of life will be much better. That's a good thing. But on the other side, this kind of cost escalation is becoming very very unviable, especially with the kind of the population structure, age structure they would have. There are more and more senior citizens and fewer younger age working age population. That I talked about the demographic disaster earlier. So little going little deeper into US spending because we have a lot of data, and also US is considered one of the reference for this some of these discussion. So the US spending increased from $0.5 trillion to 4.5 trillion in 1970 to 4.9 trillion 2023. This again, $0.5 trillion. This is inflation adjusted. This is as of today's dollar. Okay, this is not the actual dollars back then. Actual dollars could be somewhere about $100 billion or so. Okay, so this as of today's dollar, it was about $0.5 trillion in 1970. By 2023, about 53 years later, it has increased seven times. I mean, almost not seven times, almost 10 times. And just to give this number, 4.9 trillion, India's GDP in 2023 was close to $4 trillion. Okay, so the US spends more than entire India's GDP. Okay, how much we spend? About $150 billion for healthcare. Okay, so in US has four times the population of, India has four times the population of US population, and we spend a $150 billion. They spend about 5,000 billion. It's roughly about this, 35 times they spend more for one fourth of their population. Okay. So per capita spending increased from $2,000 to $14,000, $14,500 in the same period. Okay, so that's the kind of increased spending. One positive thing that has happened is out of pocket spending has come down from 32% to 10%. Essentially, now the spending is kind of spread across to actually shifted to government or spread across people through insurance. Okay. So who is providing these finances in US, right? So they're spending $4.9 trillion. Let's look at what was who were paying in 1970 and in 2023. In 1970, out of pocket was 32.7%. In 2023, it came down to 10%. Whereas in which is positive for the general public point of view. Private healthcare insurance is 20%, now it is 30%, which is good because the financial risks are spread across wider population, right? And public health insurance, that the government health insurance was providing 22% in 17, now it is 43%. That's significantly high. It's a good thing. Government is taking care, but government has become very unviable, financially unviable, right? So how can they manage it better? Right? So, and because it's also in spending has increased 10 times in the this one, so it's become very unviable. Roughly, it is about 18% of the GDP, and other sources, the charities and other things, that has come down from 25 to 16%. Primarily, insurance and government spendings have gone. So, which is one side is good because for the individuals, other side, for government, it can become uncertain. Where the money is going in US, 31% is going to hospitals, 20% is going to physicians and clinics, and the retail prescription drugs about 9%. Okay, this is major components. So if they want to improve the efficiency, these are the big features or the major areas they need to focus on. Okay, so in terms of 4.9 trillion, where that is coming, private healthcare is spending 1.4 trillion dollar, and the Medicare and Medicare, these are government insurance that's roughly about $2 trillion combined. Okay, and remaining things are coming out of pocket is coming to $500 billion. Okay, so this is another picture I just wanted to show here. Let me see how I'm doing with the time. Okay, so which health sorry age groups are taking up this healthcare spending? That's one of the key thing we need to, as you can guess, the younger the age, lesser the healthcare spending, because your health would be at a low younger age, health would be much better. There would not be much spending. As the age increases, you can see that 45 to 64 years, it's 30 to 35 percentage, is kind of spent on this one. And this is the percentage of population that's there. 25% population is 45 to 64 years. And they take about disproportionate, kind of healthcare spending. And 65%, so 65 plus years, 70%, 17% of population. And they're taking about the 16 to 17% of the healthcare. This seems to be okay, but this is the group they need to focus on. They're taking disproportionate spending for their percentage of population. I think one of the key thing is that most of the spending, that is 25 to 30% of the highest spending, happens to keep the person alive for a few more days, a few more weeks, or maybe few more months. That is the end of life or final year, excluding for smaller, younger age population, which so we have to really fight the cases keeping the person alive. But remaining the age population, it's an ethical dilemma. How long you want to prolong the medical care just to keep the person alive for a few more days or weeks? This one, right? So this is really not an easy thing for society to solve, and the policy makers to solve. Somewhere they have to draw lines. Okay, if these things happen, they have to cut down the cost for the sake of the bigger, the wider society, our society at large. And even in those age group, right, not everybody uses, only small percentage of the people use significant part of the benefit, sorry, the healthcare spending. You can see top 50% of the people use 97% of the thing, and top 20% of the people said take 82% of them. That means 80% of people takes about only 18% of the healthcare spending, whereas the remaining 8, just 20% take the 82%. So I think whoever is looking at this data, they have to look at who this 25%, 20%, why these spendings are happening. Can they be contained or kind of reduced, that kind of spending with the preventive measures put in place? I think that those have to be looked into. And I think in health, US there is a very poor health because of their lifestyles. So most nearly half of the people are obese or overweight, and that's largely to do with the poor eating habits they have. And this is a little bit of on the India health spending. This is posted by the Ministry of Finance as of 31st January 2023 in the PIB website. They show some good data. Essentially, the government expenditure, total government expenditure, has increased from 28% of the overall healthcare spending to 40%, which is good because the individuals are not spending on paper, which to some extent is true. Especially for poorer people, there are a lot of government insurances that are coming in place, right? Yashaswini, that was started in Karnataka way back in 2003, 2 or 3, and then that was replicated many states. Finally, it came as the Ayushman Bharat in the last 10 years or so, right? So the central government claims that their spending has reached nearly 5,48,000 crores. That is the total health spending. Again, the center is kind of very smartly put state and center spending put together. Yes, it says Total trend in social service expenditure, general government, combined center and state. They, the portion of the center is smaller in this case, but they want to combine and show that bigger increase. Of course, central government spending is also increased, but bulk of the spending is coming from states. I will show you how this, if for example, 22, 23, they show 5,48,000 crores. In that, only about 84 or 85,000 crores is from center. Remaining things are coming from state. So as we can see that out of pocket expenditure, it has come down from 64% to 48%. That means nearly half of the money is still spent by the public, and remaining half is spent by the either government insurance or private insurance. So just to give the kind of split between the state and center, as the center claims in this one, total spending is about 5,48,000 crore. Central government budget is about 86,000 crore for the same thing. So if you with that, government states have spent 4,62,000 crores. That probably about how much it's uh, so less than 15% is by the central government. Remaining 85% spending is by the states. So just extrapolating 52% spent by the general public, so that then will be roughly about 55% for this year. So it comes to about $135 billion the total healthcare spending. Maybe it's little on the lower side. If you want to bump it to, maybe it's about $200 billion. $200 billion for a population of 1.4 billion is not very high, because US spent $5,000 billion, whereas we spent about roughly $2,000 billion. We can see the budget lines for the health and family welfare for 22-23. It's about 86,000 crores. So I'm not trying to kind of hide or make up any number. The references are here. You can make and take a look at it. Okay. Again, this is for 24 from financial year 24 and 25. You can see the healthcare spending is about 90,000 crores by the center, and total spending is about 6 lakh crores. Okay, so this is for the 24-25. The budget, you can see that the health and family welfare, is 90,000 crores. It was actuals in 23-24. Allocated budget was 89,000 crores. It's barely changed. It's about one less than 1% has changed. So with this, roughly about $147 billion the healthcare spending, as per the government numbers, with some kind of extrapolation I have done. But my feeling is that it could be little $50 billion above this. If you look at that, and unlike US, we don't have really good detailed data for these things. This will give some kind of indication. So still the costs are not, I mean, still not too bad. And if you go back to the government, this one, so uh, it says that healthcare spending has increased. Central and state government budgeted expenditure in the health sector touches 2.1% of GDP, and so to 2.2%. So roughly about 2.2% of the GDP is spent on the healthcare, whereas in GD in US it is 18%. For us, this numbers, absolute numbers are still high, but in terms of percentage of GDP, still they're okay. It's probably till up to 5% of the GDP, they become manageable. China spends about 5% of their GDP on healthcare, and their healthcare system is on par, in many cases better than the developed world. Okay, so with that, I'll pause here on the challenges. Let me reiterate the challenges. The challenges are the demographic disasters for two sides, exploding population one area and then dropping population another area in developed world, and then the communicable diseases, and then the potential pandemics that can strike any time, And then the climate change, so I didn't talk about the climate change. They still, we are vulnerable. Climate change can trigger a lot of health diseases, health disasters. Also, it can create a lot of, safety issues, right? So, and then the costs. These are some of the major challenges. There are other challenges, but these are the major challenges that are there for the all the. I mean, most of the governments around the world, and this problem is very severe in the developed world. So, and then there are also delivery challenges in the universal coverage. Countries like US, UK, and Canada, they claim they're providing coverage, health coverage for everybody. Yes, it's true, but they're struggling to provide that kind of thing. There's huge waiting period, and the US, it's a private sector. The costs are high. The quality of the care is good, but still there are kind of a significant queue, especially for some of the cares, and also it can push a lot of people to poverty. If they don't have power. They have power for they still don't have insurance cover for about 8 to 10% of the people. Whereas for India, the good thing is that the private sector, many of the hospitals, even many of the government hospitals, they give world class service for very affordable prices. And we, think compared to any other country, I mean, not India, most of the developed countries, we have literally little waiting period for most of the care. Okay, that's a really positive thing. And so I think from that cost point of view and the access, the quality point of view and the time factor point of view, the waiting period point of view, I think there's still I mean, we have one of the best healthcare system, and I think best healthcare system is China, Southeast Asia, right? As the Vietnam, Cambodia, Thailand, and Singapore, and Malaysia, they have really good affordable healthcare and world class healthcare at affordable cost. India is almost there in terms of the quality, but I think we're many ways better than the developed world for the healthcare part. I'll pause it at this point, in this one, and we'll continue our conversation. Let me stop sharing, stop the recording.